So again, Assalamu alaikum wa rahmatullahi wa barakatuh. We will continue. The consent is very important part of the exam. It may come as a separate station or as a part of different station. So separate station, it may come as a simulated patient task where you have to take a consent from a patient for the most common scenarios for hysterectomy, laparoscopy, and for cesarean section. Or it may come as a teaching and feedback station for your junior colleague who wrote a consent form, and you have to give him a feedback and to provide him with the right way how to write the feedback and to provide him with a learning plan. So today, the first station for us will be about how to take a consent from a patient. It will be a simulated patient task for a patient who is going for hysterectomy, and you need to take a consent from this patient. The consent form, as you can see here, it is the points of our discussion today. We need to know how to fill the consent, how to talk to the patient in a lay language, especially that these stations usually come with a lay examiner. So you have to give the patient all the information in a language that will be understandable by the lay examiner. The lay examiner has to comment at the end that you are a doctor, he wants to see you in the future. If he didn't like your way in explanation, he will write a bad comment about you, and actually this station is very important because you will have double the marks from the lay examiner and from the clinical examiner. So let's start today. I need a volunteer to start this station. He will go with the station, and we have our dear colleague, Dr. Yasmin. Dr. Yasmin, she will act as the role player. She will act as the patient here in this station. One of our candidates will be volunteering to do the station. After finishing the station, I will give you the feedback and the proper way of doing this station. So who's going to volunteer to do the first station? First of all, my advice for part 3, you have to talk. You have to show yourself. You have to avoid being isolated. Part 3 is a simulation. It's not a listening exam. You have to talk. So I need someone now to be brave and to take the opportunity to practice this station. Anyone? If no one is interested, we can close the station from here. There is someone? Anyone is interested to start? Guys, it's your chance. Let's, Dr. Arti, are you interested? Dr. Maya? Dr. Hannah? Dr. Hosni, Dr. Ibtihal, iPhone, Dr. Khairi. People, you have to talk. It's an interactive session. I will not talk alone here. No one, we have 17 candidates. No one is interested to say it. Dr. Bushra, Dr. Intisar.
Yes, sir.
Go, please, Dr. Intisar. do this station.
Okay, sir.
Okay. So you will have 2 minutes for the reading. Okay. Then after the 2 minutes, we'll start 10 minutes your time.
Okay, sir.
So now you will have
Okay.
10 minutes, Dr. Intizar, for performing the station. Dr. Yasmin will be there with you. She will be acting like the patient. And now you can start.
Hello, I am Dr. Abdul Qadir, one of the doctors in the gynae ward today. May I confirm your name and age, please?
Hi, I'm Matilda Smith. I'm 45 years old.
How would you like to be addressed?
Matilda would be fine.
Okay, Matilda, nice to meet you today.
Thank you.
I understand from your notes, Matilda, that you are coming today in order to sign a consent for the operations that you have been scheduled for. I am right?
Yeah, well, I was in the clinic before, and your colleague discussed with me having removing my womb, but I need more information today.
Okay, sure. But before that, Matilda, would you allow me to ask you a couple of questions, because this is the first time to see you, in order to know more about your condition?
Yeah, sure.
Okay, could you tell me more about why you are scheduled for removal of your womb?
Well, I usually have a heavy period when my first period came, but the last 3 years I had a very heavy one that I can't tolerate, and it was so painful. That makes me take a lot of time off from my work. It's affecting my life. It was prescribed for me some medications. I can't recognize the names now. Something like acids, but it's not working as well. And a Mirena coil was inserted as well, but expelled from the first period after.
Oh, I'm really sorry about that. Yeah, it seems that you suffer a lot. That's the period before, right? So, and you go to that and you choose this surgical operation to remove your womb, isn't it?
Well,
Without your ovaries.
Well, I'm here today to discuss with you that because, as I told you, your colleague didn't give me much more information, and I'm happy to keep my ovaries as long as it is not diseased or have no problems at all.
Yeah, this is understandable. So,
Yeah.
do you have any medical condition you use your GP to see your GP for or receive treatment for?
No.
Okay. Do you perform any surgery before in your tummy or down below or anywhere in your body?
I had 3 C-sections before.
Yeah, okay. And they was uneventful? I mean, they pass smoothly after
Yeah,
your condition?
one of them more for failure to progress to normal labor, and the others no complications at all.
Oh, any history of blood transfusion before?
Yeah, I had one 2 weeks ago because I'm anemic.
Okay. Yeah. Okay. Are you allergic to any medication or any material?
Yeah, I'm allergic to penicillin.
Okay. Do you smoke?
No.
Drinking alcohol?
Yes, occasionally in weekends and holidays.
I beg your pardon. Any recreational drugs?
No.
Are you updated with your tobacco screening?
Yeah, and all were normal.
Okay. With whom are you living?
My partner and my kids?
Do you feel supported and safe at all?
Yeah, my partner is so supportive.
Okay, nice to hear that. Do you have any family history of concern?
No.
Okay. Do you know whether you have a certain concern about the way you wanted to remove your womb, either through a keyhole surgery or through an abdominal incision,
I'm not
or
sure.
a through cut in your abdomen?
I'm not sure. I need you to discuss that with me today. Give me some information more.
Okay, thank you for sharing those information with me, Matilda. Coming to your concern about the surgeries that to remove your womb. First of all, removal of the womb is really is a most definite way in order to get rid of your problem of the period. Okay, and removal of the womb, it could be done through several ways, either through your vagina or through your tummy. Through your tummy, it could be done with a keyhole surgery or through a cut in your tummy. But of course, since you have gone a previous cesarean section, the vaginal route is not suitable at all for you. Okay, do you follow me?
Yeah, but one more thing. I think that one of the ways is not suitable for me because I have a big womb. The scan shows that I have a big womb, like 16 weeks or something.
Yeah. Is the ultrasound showing any other thing about it's a big one? The presence of any swelling in it, any other, or just it is a big one? That's it.
Yeah. It's like 16.
Do you call? Yeah. Do you call what is the appearance of your womb? What is it's named? Do you know how they name it? Do you hear about adenomyosis?
I'm not sure. No.
No. Okay. So so most probably you will do it through a cut in your tummy because it is enlarged in size. Okay. So
Yes.
you know, you are coming today in order to sign a consent for the surgery.
Yeah.
This is the most important issue here together that we're going to discuss. So in order to take a consent from you, first of all, I will tell you the title of the surgical operation you will be undergone, which is removal of your womb through a cut in your tummy, through a cut in under anesthesia, most probably either under regional anesthesia or under general anesthesia will make you to sleep.
Okay. Yeah.
Do you understand? Yeah. So and the most important benefit of it is to remove the womb in order to get rid of this issue of heavy menstrual bleeding. Okay. Number two, we have to, and the most important about the consent, to have to know about the disadvantages that could result from such a surgery. Okay. So
Yeah.
we have what we call serious risks and what we call frequent risks. Frequent risks that occur secondary to this surgery, that is occur in most of the cases who has undergone that surgery. For example, like it is you are liable to the development of bruises around your wound. Okay.
Yeah.
Also, you are liable to wound infection or the infection in your tummy, the wound in your tummy to be developed to become inflamed and infected. Okay. Also, sometimes some sort of numbness and tingling, you will feel it for several months after the surgery, especially if it is also a cut of in your tummy, because you know the very tiny nerve endings at the skin of your tummy will going to be exposed after cutting in the skin, so that those nerves will be very sensitive, leading to you will practice a sensation of numbness and tingling and burning for a couple of months after surgery, but it will gone by its own. Okay, after that.
Okay, so
Okay.
are there any chances to decrease the possibility of that happen?
Actually, unfortunately, I don't know how to decrease it, but if you take a painkiller, a certain painkiller medication after the operation, and occasionally when you feel that, you will be improved a lot, then it will gone by its own after that, after some time. All right.
Okay.
Also,
Yeah.
because a catheter will be put into a urinary bag after the during the operation. After that, you are liable also to get infection in your urinary bag. This is also one of the frequent risk. And because we remove the womb and leaving the ovary, providing both ovaries seems healthy, so that this will enhance that your ovaries to reach its to be more and more aged, and in order and to fail to work after some time, more than if you didn't remove your womb. Okay, so
you mean that you will remove my ovaries, isn't it?
no, I'm sorry, you didn't get me. If it is not, if the ovaries are looking not healthy,
Okay.
I will remove it.
Yeah.
We will remove it. But if they look healthy, and of course we will say, because you will benefit from the hormones of your ovaries after removing of the womb for a couple of years.
Okay, that's good.
What I'm saying that your
because I need to have my ovaries.
Yeah, it is very important really for the health of your bones and your heart. Okay, but what I'm saying that they could fail earlier if you didn't more early, if you didn't remove your womb. Okay.
Can I interfere,
Coming
please?
to the
Dr. Ansar, sorry. Your
yes,
time finished.
yes, sir.
Your time now 11 minutes. Just for the sake of the time and to control your time later, you have to know that your time is done and you are still in the middle of the station. Okay, so
yes, sir.
If you have 1 more minute and you want to close the station, what you are going to do now?
I will tell her that I will provide her with a copy of the consent form, which is free. In order to, if you wanted to read it again, and in order to, before she is taking her final decision, to sign that consent. And if she have any question, I'm delighted to answer her question. If she wanted to, I will make an appointment with the consultant in order, if she have more concern, I will be delighted to do that.
Okay, perfect. This is a good way to close the station. So let's comment about your performance and how to approach this station. First of all, for all of you, the 2 minutes for the reading are very, very important. They are the base of your performance in the station. Dr. Ansar, you had a problem with the situation awareness in this station. So this lady, she's 45 years old. She's on the day of her surgery. So today is her day of surgery. So she's not coming to sign the consent. She is today going for the surgery. That's why when you discussed the aim of the consultation with her, it reflects that you were not aware of the scenario. Okay. The second point, he's telling you, following a previous investigation, she's now scheduled to have a total abdominal hysterectomy with conservation of her ovaries for an enlarged fibroid uterus. So she is going for abdominal hysterectomy for enlarged fibroid uterus. So there is no way here for vaginal hysterectomy. And if it is laparoscopic hysterectomy, it needs a morcellator, which is not indicated now or contraindicated now because there is safety issues regarding the morcellation. So this lady is going for total. So you wasted part of your time in discussing options which are not there.
Yes, sir. I'm sorry. I missed that totally, sir. Yeah.
Yes,
thank you.
That's why it is very important, please, everyone. The 2 minutes at the start of the station, the 2 minutes reading are very, very, very important. Now, from the next exam, you will be going for face-to-face exam. So you will have your block notes in your hand. So write the notes to keep it in your mind. So this lady, she's in the day of her surgery. She's 45 years old. She has previous investigations. She has a fibroid uterus, and she's going for total abdominal hysterectomy and conservation of the ovaries. And she was transfused blood 2 weeks ago. Okay, and her BMI is 30. So there are very important informations here you have to put in your mind before going inside the station. Is that clear?
VTE risk assessment, sir.
Yes, exactly. So now going to the station itself. You have a very good way of introducing yourself, Dr. Ansar. So, but this station, you know exactly what is the patient. So you can go in a different way. Hello, Matilda Smith. I'm Dr. Ansar, one of the doctors in the ward, and I'm going to be helping in your operation today. Because one of the important criteria of taking consent, the consent has to be taken by the one who will do the surgery or one who's trained to take a consent. Okay, so I'm Dr. Ansar, one of the doctors here in the ward, and I'm going to be helping in your operation today. Nice to meet you. Nice to meet you. How are you doing today? I'm fine. Your way of introducing yourself was very good. But the problem was in the aim of the consultation. So the aim of the consultation, you have to confirm that she's aware of the type of the surgery she is going, and if she has any other concerns or expectations regarding her surgery, you will answer all her questions today. So you can say, so can you tell me what operation are you coming to have done today? So then I'm here to confirm that you signed the consent for the surgery, ask you some questions, and answer your questions if you have. Okay, Dr. Ansar? Hello?
Yes, sir. Yes,
okay.
I'm just, I mute myself, that's it. All right.
Okay, so the next step will be the concerns and expectations. Please, everybody, do not forget to ask the patient, any patient in any simulated patient task, about if she has any other concerns or expectations from the consultation or from the meeting today. This question is very important because it may show a hidden agenda from the patient, or the simulated patient will help you with giving the core of the station. So please do not forget to ask the patient at any station if she has any other concerns or expectations apart from the aim of the consultation today. So the patient here, if you ask her any thoughts that come in your mind about your surgery, so the patient will give you the main point of the station that you have to go around. The patient will tell you here, I want to have a total hysterectomy. She wants to have a total hysterectomy. So I don't have to do any more smear test. So she wants total, not subtotal hysterectomy. This is number one. Number two, but I want to retain my ovaries. I do want to hear more information about my surgery to be able to make this major decision, as the last doctor did not have enough time to explain the procedure. So this patient has three concerns here. She wants total, not subtotal. She wants to keep the ovaries, and she wants more information because your colleague, he didn't give her enough information when she was in the clinic. So at this point, you have to apologize that your colleague did not give the full information and offer her all the information she wants. Coming to the point of the history, you asked her permission to ask her some few questions, and you give her a very good agenda that you will answer her concerns, and by the end, she can sign the consent if she agreed to it. Is that okay? Yes or no? Dr. Ansar, it is a common problem in our candidates. They are usually forgetting the analysis of the presenting illness. Okay, our Dr. Yasmin, or our patient today, she volunteered to give you some information about her problem. Okay, but you didn't explore more. What's her main problem here? Her main problem is the bleeding. You didn't ask about the blood test or scans, because if you ask it, she will tell you that she has an ultrasound showing that she has a big fibroid, the size of 16 weeks. This point will not allow you to tell her that you have a chance of having vaginal or abdominal or laparoscopic hysterectomy. Is that clear?
Yes, sir. Yeah.
So,
yes, sir.
Very good that you showed some empathy when she told that this is affecting her life and she's having heavy periods and this was difficult for her. At this point, you showed the empathy, which is very good with communication with the patient. You asked about the last menstrual period, right?
No, sir.
Yes, you didn't ask, which is very important because you have to exclude the possibility of pregnancy before going to hysterectomy or any surgery. So this is a very important safety point. So if her last menstrual period is missed or she's about to have her periods, so you have to ask her any chance that you may be pregnant. If she doesn't know, so at this point you will offer her pregnancy test. But this lady, because you didn't ask about the contraception, she didn't tell you that her husband has vasectomy already. So there is no chance that she will be pregnant. In any case of bleeding, Dr. Insar, you have to ask about all types of bleeding: intermenstrual bleeding, postcoital bleeding, and the heavy menstrual bleeding, because this may reflect other causes of her bleeding. If she's having postcoital or intermenstrual bleeding, there may be possibility of cervical cause, polyps, vaginal, or whatever other cause other than the fibroids and the hair periods. She told you in between, yes, I tried treatment. I remember 2 acids, but I don't remember the name. Here the patient is acting if she's asking you what about the names. So what are the 2 acids that she may be using here, Dr. Ansar?
Tranexamic acid and mefenamic acid, sir.
Perfect. So when the patient acts as if she's not remembering, and this is part of your job, you have to remind her, you have to ask if she's taking mefenamic and tranexamic acid. If you mention, she will agree and she will be happy that you guided her to the medicine she forgot. It will be a very good point of communication and clinical knowledge. Very important in the safety is that you asked about the smear test. And are you aware of your body mass index? You have the body mass index already, which carries risk during the surgery and risk post the surgery, because this lady may have risk of VTE. The surgery is very important, all by cesarean section. So this is important because it increases the risk of adhesion and it increases the difficulty during the surgery. The medical history, blood group is important in this lady, you have to ask, and the transfusion already mentioned. Very good that you asked about the allergy, because this patient is allergic to penicillin. If you didn't ask about the allergy, this patient may have borderline, you may have borderline in safety. Doctor, there is a question here, STI, we have to ask or not? You don't have to ask about STI here. Why STI specifically in this case? It is not relevant here. So the family history of concern, you should be more specific in this. Any family history of cancers in the womb or the breast or the ovaries, because at this point, it may affect your decision to keep or remove the ovaries, right?
Yes, yes.
The social history, and very good that you were happy that she has enough support at home. So this is regarding the history and the information gathering. Now the patient gives you that she has some concerns, Dr. Ansar. She wants to remove the uterus and she wants to keep the ovaries. So you have to answer these questions. You have to give her what she wants at the beginning. So you will tell her, we have different options when we want to take the womb out, either to remove it only or remove it with the ovaries. And this depends on many factors, including your own wishes. For example, if you have a family history of ovarian or other forms of cancers, at this point, we recommend to remove them with the womb during the hysterectomy. Am I clear till that point? You have to check her understanding and she is following you in between. Okay?
Yes, sir.
The next point, as you are 45 years old, this is a situation awareness. It means you read the scenario well. You know that her age is 45, which is quite far from the age of menopause, Matilda. If you don't have any risk or obvious reason to remove your ovaries, we will recommend to keep the ovaries, but we can remove only the fallopian tubes. So that's very important. When you are going to remove the uterus and you want to keep the ovaries, remove the tubes. Okay, why we are removing the tubes? This is to protect you from some types of ovarian cancers. Please mute, there is someone is opening the mic. Please mute yourself, please. So if you are going to keep the ovaries, please recommend that you will remove the fallopian tubes. So the next point regarding total or subtotal hysterectomy. So in terms of taking the whole womb away, including the neck of the womb, which is the area from where you are taking the smears, we will try to do our best to remove it all the way. But sometimes during the surgery, it may be technically difficult because the size of the fibroids you have, or because of the scar tissue that was formed as a result of your previous surgeries. So we will keep it, but you have to continue your smears to be taken. And the good thing here is that all your previous smears were normal, so you don't have to frequently do it, and you will do it only every 3 to 5 years. So this is the second point of concern for this lady, to remove or not to remove the womb. You are going to do your best to remove it all, but there are sometimes difficulties because the size of the fibroids, because of the previous cesarean section, so you may keep it. But for point of safety, if you are going to keep it, you have to advise her to continue doing the cervical smears. Okay, so now you answered the concerns of the patient, Dr. Ansar. Coming to the consent form. And the third point is that your colleague in the clinic, he didn't give her the enough information. So now I want to go through more information about your operation, including the risks of the surgery. Here, if you give the patient the information in a frank and hard way, this will be frightening for the patient, and the patient will be afraid to go for the surgery. So you have to give her the facts in a good way, in a non-frightening way. So the best way to say is to say, it is a routine operation that we are doing very frequently. We will mostly go through the scar of the cesarean section in your tummy, but we will assess you again when you get to sleep. So we may consider doing an up-down cut in your tummy, especially with the large size of the fibroid. So you are reassuring here that it is a routine operation that's done every day. You will minimize the scars in her tummy by going through the previous cesarean scar, but the decision may change after the patient will be living under anesthesia, and you may consider giving midline incision. The second point, the time of the operation. It will last for an hour. We will give you some fluids through a cannula or a tube inserted in your hand, and will insert a catheter to drain your urine, which will be removed as soon as possible when you wake up, and you will be able to eat and drink. You will stay in the hospital for 2 days, and then you will be discharged and allowed to go home, and you will be informed when to come back in case you have any problem. And this is very important. If you are going to mention the discharge to any patient, you have to mention the red flag points and the points when the patient has to come back. Also, you will give her some information about the recovery. After going home, you will avoid driving, heavy lifting for between 4 to 6 weeks. You will need to put a tube to drain. We may need to put a drain or a tube to drain out any fluids, which will be mostly removed in the next day. The stitches will be dissolvable, so you don't have to remove it later. Mics, please. Mics, please. So some information about the surgery, some information about the recovery. Now go through the consent form, Dr. Ansar, step by step. So if you are happy with what we discussed, I would like to take you through your consent form for the procedure. In this station, you will have the consent form in your hand, and you have to act as if you are going to fill the consent form. So you have to fill it as if you are in real situation. And this is an interactive discussion with the patient. So you cannot talk alone. So the best way to do this, so let me confirm your details. Your name is Matilda Smith and your date of birth is 4 August 1977. Is that correct? Yes or no? So ask the patient what is the name of the procedure that will be done today. This is a point where you will mention or you will assess the capacity of the patient. She understands what she's going to do, and she can retain it, and she can repeat and communicate it. So now you are assessing the capacity of the patient. She understands, she can repeat and retain and communicate the information. So ask her, so can you tell me what is the name of the procedure that you have been offered? She will say, yes, I'm going for hysterectomy with conservation of my ovaries, which means leave the ovaries in the space and act in the station as if you are writing the name of the procedure. The next point in the consent here will be the intended benefit. So the first point of the consent will be the name of the patient and her identification or label, NHS number and date of birth, then the name of the proposed procedure or the course of the treatment. The next point will be the intended benefit. So you will ask the patient, can you tell me what you understand about the intended benefit of hysterectomy? She will say it will reduce the heaviness in my periods and stop it at all. So the next point will be the risks. The next point will be the risks here, but it is a good practice to keep the risks a little bit later. So move from the intended benefit to the type of anesthesia. After our discussion, Matilda, the anesthetist will come and discuss with you your options of anesthesia. You may have the procedure under general or regional anesthesia, and you will have a chat with the anesthetist regarding this later. Is that okay? Yes or no? The next point will be the risks of the procedure. Again, you have to tell her in a non-frightening way. Matilda, hysterectomy is a very common procedure that usually passes smoothly, but possible risks can occur as we discussed before. These risks include serious risk like bleeding, like damage to other organs, formation of blood clots. You may need to be returned back to the theater, or even very rarely death. Am I clear so far? Yes or no? It is very important for the safety to mention at least 8 of the risks of hysterectomy. If you didn't manage to mention at least 8 points from the risks of hysterectomy, you will have a problem in the safety in this station. Coming to the next point, there are more frequent risks like infection, like urinary tract infection, frequency and pain, and altered sensation around the scar. You may have hernia at the site of the scar, and you may have problem of anesthesia. Dr. Antisar, you spent 1 minute explaining the altered sensation around the scar, which you can go through it very quickly. You just mention it. Just mention it. There is no need for that much explanation, because the station is very full and you need to keep your time for more important things. Is that clear? Hello?
Yes, sir, I'm here.
Okay.
Yes, sir.
So the next point will be the extra procedures that will be done during the procedure. The extra procedures here will be about the blood transfusion and any other surgical intervention. So you have to mention the blood transfusion in each case, and if she has any concerns regarding the blood transfusion, because she may be a Jehovah's Witness and she will refuse the blood transfusion. But in this case, the patient already had a transfusion 2 weeks ago. So she has no concerns regarding this. Okay. The other procedures you have to mention about repair of any damaged organs, any damaged viscous during the surgery. She may have bladder injury, bowel injury, or ureteric injury. So you have to mention, in case of any injury to any of the organs in your tummy, we may need to go and repair it during the surgery. Okay, so these are the points in the consent. You have to mention it. You have to confirm the patient name, date of birth, and the NHS number if present. You have to ask her about the name of the procedure, the intended benefit, the type of anesthesia will be discussed with the anesthetist, then go through the serious risk and frequent risk of the procedure, whatever the procedure in the station, then come to the extra procedure which may be necessary, especially the blood transfusion and the other procedures. After finishing this, now you have to sign yourself the consent and offer the patient to sign the consent. So how to close the station? Exactly as you said, Dr. Ansar. Okay, Matilda, before I sign here, you, as the doctor who will take the consent, you have to sign before the patient. Before I sign here to tell that I give the information that I have just discussed with you, do you have any questions? Before closing the station, you have to ask the patient or the simulated patient if she has any questions, because sometimes they are giving her instruction. If the candidates didn't mention this point, please ask 1, 2, and 3. So before closing any station, please ask your patient if she has any question. So if she say no, I will give you a useful written information leaflet that you can go through it. It contains all the information that we have discussed now. If you think that I have given you all the necessary information, would you please sign here and ask the patient to physically sign the consent during the station? If you didn't ask the patient to sign the consent during the station after finishing giving her all the information, you will have borderline in the safety. And then tell the patient that you will be provided with a copy from this consent and the other copy will be kept in her records. And thank the patient. Thank you. I will see you inside the operative theater as I will be helping in your surgery. Okay, so this is how to go through this station. There are some points here regarding the risks in details, so we can go through it. But for the sake of the time, the most important part or the core part of the station is to take a history, answer her concerns regarding keeping the ovaries and removing the neck of the womb or to do total hysterectomy, and then complete the consent provided. So very important to have an agenda from which you are expected to do. You have to take a targeted history. You have to answer her concerns. So ask her if you have any concerns or expectation. And finally, you have to complete the consent form. This is the station. These are the points of the agenda of the station. You have to go through it. Okay, Dr. Ansar? Do you have any questions?
Yes, sir. No, thank you, sir. Thank you, really.
Will you
explanation is very good.
Okay, will you change your approach now in doing the same station in the future?
Yes, sir. Of course, I will rehearse on that and I will try. Yes, sir.
Okay.
Sure.
And
thank you.
Take care of your time, Dr. Ansar, again, okay?
Yes, sir. Okay.
Any questions? Any question from any other one? Any questions? So anyone can tell me how to evaluate the competency of the patient during taking the consent?
It is.
Yes.
We will check after giving information. Then we will ask whether she can retain or can retain and respond properly, and also she can repeat.
Yes, exactly.
Information.
Exactly. So the patient has to understand what you are telling her. She can retain the information and she can repeat what you are telling her and she can communicate a decision. Her consent should be given voluntarily. She's not forced by any way to give the consent. So this is the way how you are evaluating her during the consent, and she understands the implication of no treatment, and she was offered alternatives before. So this is the point how to evaluate the patient during taking the consent. Okay, so we have another scenario. I need yes.
Excuse me, one question. This case preoperatively on the day of surgery. Why we are taking consent on the day of surgery? Must be already already taken, and it may be asked for revision for all consent on the day of surgery.
The consent has to be taken in the pre-operative clinic. But
yes,
this patient here has some concerns because she said, I do want to hear more information about my surgery to be able to make this major decision, as the last doctor did not have enough time to explain the procedure. Okay, so I already mentioned it on the YouTube lecture that you can take the consent immediately before the procedure, but it is vital to ensure that she has been offered the opportunity to further discuss any intervention in a clinic visit or a visit in the pre-operative assessment unit. If this patient was not offered an information before, you may postpone the procedure at all. Okay? So
Okay.
this patient has an opportunity to discuss it before, but she still have some questions. So you will answer her questions. If she has any queries or if she is doubtful about her decision, so that by the end you will ask her, if you are happy with the information that I give you, you don't want any more information, I will sign here and you may sign here if you don't mind. So the consent has to be taken in the pre-operative clinic, but you can confirm the consent immediately before the operation, provided that the patient has an opportunity to discuss the intervention before. Any other questions?
Okay. Thank you.
Any other questions? Okay. We have one more station. If anyone is interested to join, anyone is interested to do it, is a teaching station, teaching module, and giving feedback. Guys, I need volunteer. Will I choose myself, Dr. Ahmed? Dr. Ahmed? Dr. Amal? I will wait for 1 minute. If you are not interested anymore, I will just give a feedback about this station and we will close. Actually, this will not be the intended benefit of the session. The session is an interactive session. I'm not here to talk alone. Ladies and gentlemen, we have 25 candidates here and no one wants to say. Dr. Hana, Dr. Hosni, Dr. Ibtihal, anyone? Huh? Huh? Okay, so this is not the good way I wanted to have the session with you. Actually, to have a benefit, you have to talk, not only listening. Part 3 exam, you have to talk. It's not only a matter of listening.
Hello, Dr. Siru. It's
Yes.
Dr. Hassan.
Yes, doctor?
I'm Dr. Hasnain.
Dr. Hassan.
I'm not in practice nowadays, but I really want to attempt.
Okay, very good. This is very good from you. So you have 2 minutes, read this scenario, and then we can start.
All right.
Okay, go on.
All right.
2 minutes starting from now. My advice for all of you people, you are going for part 3 exam, you will talk during the whole exam. You are going for simulated patient, you have to talk to the patient, you will talk to a colleague, you will talk to your consultant or to the examiner. So it's not a matter of a study like part 1 or part 2, you are facing only the answer sheet. You have to practice talking. You have to talk all the time, talk to yourself, talk to your mirror, talk to your partner. This is a very important part. You have to start practicing. You have to adjust your time. You have to finish all the stations in 10 minutes. This will come only with practice. Listening only is not enough. Listening is only the first step. Then after each station, you have to do yourself the station. So my advice for you, please, after finishing this session, go and through the 2 stations and practice it with yourself or with your partner.
Sir, Assalamu alaikum. I want to, I'm Nazni. Sir, I just, because like me, I just newly passed. So I don't know all these things. That's why I joined. Sir, if you don't mind, you can take some this lecture about this communication skills and this communication with colleagues, and this means just to give idea, this domains idea, if you don't mind. Later on, I'm not talking now. Later on, if you can do.
Okay.
For the newcomers, it will be helpful.
No problem, but the communication will be different according to each station. So I don't like you to put a fixed frame in your mind, because you will do the same in all stations. So like the previous station, you have to change your introduction, the way you introduce yourself, because you know that this patient is Matilda Smith. So you can start with mentioning her name instead of saying, can I confirm your name and age, please? You know that there she's Matilda Smith, and you are going to this patient specifically because you want to discuss with her the surgery. So each domain or each module has its way of introducing yourself, communicating, and the points of safety in each module, communication with the patient and communication with colleague. But I will try to make a concise lecture about this one. Okay, I will put it in the plan.
Thank you so much. Because see, for us, I'm talking new one. We don't know what is this safety. We know little safety, but when we have to apply these things and clinical knowledge is okay, then we have to take from her the history. This clinical knowledge means this. And if we are going to have a communication with the colleagues, this is the one you are asking now. And communication with the patient means this is one, the one with counseling. These things I am asking, they means we have, I'm talking myself that we have to know the new one, that what is these things. You are right, really. Thank you so much, really. So nice of you.
Okay, no problem.
And sir, please, one question. If you have a Telegram group, please, can you put the link if you don't mind? You don't have any Telegram group?
I have a Telegram group. I will put the link at the end of the session.
Please, millions of thanks. So nice of you. Thank you, sir.
You are welcome. Okay. So are you ready? Hello? The one who will take the station.
Yes.
Ready? Okay.
Yes, dear, I'm ready. I'm ready. Can I start?
Yes, you can start.
All right. Hello, I'm Dr. Sima, one of the ST5 here in the hospital. How are you?
Hi, I'm fine. I'm Yasmin.
Yasmin, nice to meet you.
Oh, thank you.
Yasmin, I came to know that you have just joined our hospital as second foundation year. Am I right?
Yes, this is my second month here, and I have some issues regarding write down and a consent, and I'm here today to help me. Is it okay?
Yeah, definitely. We are here to teach the junior students also and the doctors about the different things. Just tell me, how is your training going on?
Yeah, it's going well. All people here are kind and helpful. Thank you for asking.
Yeah, sure. Yasmin, we always work here as a team and we are always there to help. In case you need any help, you can come to any one of us. I assume that today, as you are saying that you are here to take consent for the elective C-section, but one of your colleagues have already taken a consent and you want to discuss that with me. Is that so?
Well, I write it down, but I'm not sure if I did that in a proper way. I didn't see anybody to write it before, so I'm here now to discuss with you if I did anything wrong and how to write it in a proper way.
Yasmin, I really appreciate that you make this attempt, and no problem. We will go through this consent form together and we'll see what you have missed and what you have right nicely. And then at the end of the day, I'm sure that you will be able to take a proper consent next time. And for further information, I can give you some links from RCOG, from Strategy, and some links from the CHOG articles also, that how to take a valid consent. There are some scientific papers about it also. So I hope they will help you in future. So can you, okay, just let's go together with this consent form and see that how to take a proper consent. Let's start from the first point that you wrote the name of the proposed procedure. Yasmin, you write very rightly that it is a lower segment C-section. But isn't it good if we just write that whether it is elective or emergency C-section? What do you think?
Yeah, I think this will be more informative. Yeah.
Exactly. You're right that because you're going for a cesarean for breech presentation, most likely it is an elective C-section according to the note. So better to write in that way. Yasmin, it's always good to be communicating with the patient who is going for the surgery. You have to explain in a simple words that what does this lower segment C-section means, where you will going to be give a cut, who will be going to do the surgery, who will be the assistant, and all the information. You are just there to give her each and every information. And at the end of the day, you will show her that this is the consent form. This is, you will be signing it as you are the one giving the information. Then she has to write that she got all the proper information. And then if she agrees, she will sign it properly. You will give her a copy also. So you just have to reassure from the very start about this. Am I clear up till now?
Yeah.
Good. So after explaining her the simple procedure in simple words, then you have to give her some benefits, that what benefit this procedure will have, that it will be a safe procedure for her, for the baby, as the baby is in breech, and what are the associated frequent and some serious risks with the procedure. But before going to these details, it's always good to have a basic idea about the history of the patient. You don't have to take a detailed history, just like some medical problem if she has if she has some previous surgery, if she has any allergy, any history of blood transfusions, and if she, because all these factors can affect her even the recovery from the procedure and the procedure itself even during the operation. So just take that, like a smoking if she's having alcohol intake, like that. I hope I'm making myself understandable.
Yeah, so
Good.
simple. Thank you.
Good. So for the frequent risks, you can explain to her that with every procedure, there's a risk of having bleeding, infection, and some like related procedures. And for the serious risks, and like blood transfusions, as you said, and for the serious procedures, you can, as you wrote, like hemorrhage, blood clots, very nicely. It is very important. You said the injury to the bladder, bowels, and some related, and cut to the baby. I'm sorry, what you wrote here, cut to the baby?
Pardon me, say it again.
I was just trying to understand what you wrote in the procedure risk, like hysterectomy and cut to the baby. All right, that's good that you wrote that it is a very
I'm
rare
sorry, I'm not sure.
complication.
Yeah.
It's okay. Can you repeat with me that what frequent risks she can have during the procedure?
Yeah. I'm not sure. I don't know. Sorry.
It's okay. Just be with me. And okay, now you have to tell her that what kind of anesthesia you will be offering, and reassure her that your colleague anesthetist will come to her and will explain the procedure in the detail. After explaining all these things, you have to tell her that how her recovery period will be, what she should expect immediately after the operation, when will be the discharge date, and what she should do after the discharge, when she can join the work, when she can have sex, when she can have start the early mobilization, when she should keep her the antibiotics and even the painkillers. Like, you have to give a whole discharge plan to her even before the procedure.
Okay.
I hope you are
Yeah.
following me.
Yeah, that's
Good. it's very important to give her some patient information leaflet also about the procedure. It will make her easy to understand it. And if she has any further concerns, she will going to discuss with you also. And always involve your consultant also if you have any concerns serious about her which you're not understanding well. And then sign it at the end of the form that you have given all this information to her, and ask her to sign if she understands all the information. Write the date and the time when you are taking the consent, give her a copy, give her patient information leaflet, and ask her about any further concerns. Do you have any questions up till now, Yasmin?
Yeah, I need to ask you if you have any comment on my consent that I already wrote it down.
Yasmin, yeah, good. As I mentioned that always put the mode of cesarean, like it is elective or it is emergency. The intended benefit that to deliver this baby safely, very nicely, intelligently, you wrote this, through a cut in the abdomen and the uterus. I will say that first inform her about the frequent risk, like simple hemorrhage, simple bleeding, and the infections, and then go to the serious, which you wrote very nicely, blood clots, hysterectomy, and some risk to the baby also, and the risk of transfusion also. You explained about the anesthesia, that's very nice, but I can't see, Yasmin, that you have informed, you have provided her the patient information leaflet. Did you, have you done so?
Yeah, I think I did, yeah.
That's good. That's good. You signed it very nicely, and even the patient signed it. You mentioned your job title. That's nice. And yeah, but I hope once you will come to learn about, there's a RCOG paper about the obtaining valid consent, try to go through it. And next time, whenever you will fill a consent form, just bring it to me. We will go through it together once again, anytime when you have time. And I'm always there to help you. Any other question, if you ask, I'm always available.
No, I'm good. Thank you. Thank you so much for your help.
I'm always there for you, Yasmin. Thank you so much. And just go on with your training, and good luck for that. Thank you so much.
Thank you. Have a nice day.
Same to you, dear.
Very well done. Very well done. The most important thing is that you finished 1 minute earlier before your time. And Dr. Bushra, why you are putting red lines on our screen? Okay, so I'm sorry, I'm very bad with the names. What was your name, doctor?
Dr. Hussain.
Doctor, again?
Hasnain.
Hasnain.
I'm sorry, it's a difficult name.
No, it's easy. It's easy, Dr. Hasnain. So very well done. Very, very well done. You did the session in a very good way. In spite that you are telling that you are not very good in that, but you are very good. I have some comments.
Sir, I did station after years.
Thank you. So for Dr. Nancy, she was asking about how to go through this kind of station. This is a teaching and feedback station. So you are going to meet your colleague. So the introduction will be different than if you are going to meet a patient or your consultant in a structured discussion. So here, the way you are introducing yourself is the same as Dr. Hasnain did. She said, without doctor here, because this is your colleague. I'm Hasnain, one of the ST5, and you? The reply from Dr. Yasmin, she said, I'm Yasmin. She said, Yasmin, the FY2 or foundation year 2. So here you are calling each other without doctors because you are colleagues here. Okay, then after the introduction, make a good rapport with your colleague. Nice to meet you. How things are going in the department. So you are checking here if your colleague is under any form of bullying or undermining or no. If your colleague is under any form of pressure or no. So this question is very important. How things are going in our department. How did you find your training till now? Because sometimes, especially in the teaching station, it will be a bullying or undermining station. It will be completely away from the teaching, but it will come as a teaching scenario. During the scenario, you have to discover if it is a teaching or it is bullying or undermining station. So this question is very important, how things are going in the department or how you are doing in your training so far. The next point, you have to check her background. So did you write a consent form before? Yes or no? And did you know about the patient? You have to ask, because again, the one who is taking the consent is one who knows about the patient, who knows about the procedure, or the one who will do the procedure. If the answer is no, so there is a very important question here you have to ask. So why did you write the consent? So again,
All right.
You have to ask this question. If you don't know about the patient, if you are not going to assist in this patient, or you don't know the steps of the procedure, why did you write the consent? Because again, he may be forced by someone to write the consent, and the station will be a bullying or undermining station. So this question is very important in a teaching station, especially in stations where you will give feedback. In a consent station, if discharge letter, if it is an MDT letter, or it is an operation notes. So ask the candidate or ask the role player or your colleague, did you write it before? Yes or no? So do you follow up the patient? Do you know information about the patient? If he said no, so ask, so why did you write it yourself? Because here the station may be twisted into a bullying or an undermining station, because someone forced him to write what he should not do. Am I clear so far? So introduction. After the introduction, you have to make a good rapport with your colleague. Then the next point will be check for bullying and undermining. Then the next point will be to check the background, and the background, if he knows how to write the form, and if he knows or he have any information about the patient. The next point, in any station, please always remember to put an agenda of your station. So again, Dr. Hasnain, you didn't mention the agenda that's provided to you. The agenda here, you have 10 minutes during which you will review the consent of your junior colleague and provide a feedback. So the first part of your station is to provide feedback about the consent he wrote. Then explain the principles of obtaining a valid consent. You didn't mention this point. So the second point in your station is to, Dr. Bushra, close your camera, please. Dr. Bushra, close your camera. Okay, let me help you. So, Dr. Hasnain, as I said, you mentioned about the consent and you provided feedback, but the second point of the agenda, you missed it completely. You didn't explain to him the principles of obtaining a valid consent, which is a very important part of the station. Then supporting the trainee in their ongoing education, you did it well. You offered them some articles, consent forms, performance, and training. So you did the two parts of the station and you forgot the middle part of the station. Okay?
True.
So now in any form or any letter, you have to explain the importance of the station. You have to explain the importance of the letter. So, Yasmin, let me tell you that the consent is very important part in our work. It is a medical legal document because of the patient later. She may come and she's unhappy about her surgery or the procedure. What was done? This will be a legal document that will support you if there is any legal claims. Okay? Am I clear? So now, Yasmin, the consent has to be clear, has to be legible, has to be informed, and the patient should be competent. Okay? Any patient you are going to take a consent from here, she should be competent. And competent patient, Yasmin, is a patient who understands what you are telling here, who can retain, who can repeat and communicate the information. Am I clear, Yasmin? So can you tell me what are the criteria of the competent patient? In between, Dr. Hasnain, you have to ask her some questions and you have to communicate with her. This is an interactive session. You were talking alone most of the station. Okay, so you have to give her the information and ask her to repeat in between. This is a teaching station. So you have to check if she's understanding and if she's following you or no. So ask her 1 or 2 questions during the 10 minutes and the answer should be very simple and very concise. Don't ask a long question that needs a long answer, because by the end, the role player is not a doctor or not a real colleague, so he can catch 1 or 2 points. So please don't ask a question that needs a long answer. Okay. Now go to the consent form. So let's go through your consent form. Always when you are giving a feedback, remember the feedback sandwich. And I mentioned this in the lecture for the discharge letter. When you are giving a feedback to your colleague, always give the positive first, what went well, then the negative, what could have been done better, then positive again, so what we need to improve and provide him with a learning plan. So always start with the positive. So Yasmin, you did very well writing the consent, but how did you feel about it? Did you find any difficult parts that you need help with it? Now you are explaining again if she has some concerns, or you are asking for hidden agenda from the patient, from the role player. Always ask during the station. So did you find it difficult or you need any help with any part of it? Here, the role player is not a doctor. He may leak parts of the hidden agenda of the station. So always ask, do you have any concerns, any other expectations? Do you have a difficult part or any part that you need help here? So this is the point. Now go step by step in the station. Yasmin, you did very well writing the name of the patient and her date of birth. This is very important for identification of the patient and for safety. Well done, Yasmin. So you are praising her. You are giving her positives. Yasmin, I can see here that you wrote the name of the procedure, LSCS, lower segment cesarean section. Yasmin, this is very good that you know the name of the procedure, but the patient will have a copy from the consent form. So no abbreviations are allowed in the consent form. So it's better to write it lower segment cesarean section and avoid abbreviation, because the patient will not understand this in the consent form. Is that clear? Okay. Don't you think it will be better? Yes. Okay. Yasmin, if you add also the indication for the cesarean section, it will be more informative. So it's better to write for the name of the proposed procedure. It is a lower segment cesarean section for a breech or for buttocks down position or presentation of the baby. Okay. Dr. Hasnain, are you following me? Hello? Am I audible to everyone?
Yes, doctor.
Yes, doctor. Yes,
Okay.
you are audible.
So coming to
Yes,
the
sir,
next,
I'm following you.
okay, coming to the next point is the intended benefit. Very well done, Yasmin. You wrote delivery of the baby safely through a cut in the abdomen and the uterus. It's a very good point, and you mentioned it clearly. But again, Yasmin, this copy, there will be a copy with the patient, so it's better always to avoid any jargons during writing the consent. So it will be better if you write womb instead of uterus. Don't you think that? She will say yes. So always during teaching station, avoid saying you should write, or you have to, or you must write. Always say it in a good way to avoid undermining your colleague or putting him or in a blame situation. So don't you think it will be better if we write womb instead of uterus? Yes or no? Okay. The next point, here I can see that you wrote the risks in the of hysterectomy. Very well done, Yasmin. You wrote hemorrhage, you wrote blood clots. You mentioned the infection, the injury, the risks to the bowels. But I can see here that you wrote the risk in percentage. Yasmin, it will be better if you write the complication in a numerical form. So if you want to write 1%, it's better to write 1 out of 100. Am I clear so far? Yes. So Yasmin, me myself, I always forgetting the figures. So I'm not sure that the incidence of blood clots after hysterectomy or after cesarean section is only is 1%. I think the incidence is about 4 to 16 out of 10,000 women. So it's better if you are not sure of the information, you can go back and check it in any reference, or you can go through your mobile and ask for it, or ask your colleague or ask your senior. It's better to write it in a good way. Don't feel shameful to ask or to search for the good information, because I think this figure is not correct. Am I clear? Yes or no? Coming to the next point, you mentioned the extra procedures here. You mentioned that the patient may need blood transfusion. Very, very good, Yasmin. Because this patient may need a transfusion at any time, she may bleed, and this is a procedure that may be done in any surgery. But don't you think it will be better if you add that we may need repair of any viscous that may be injured during the surgery? It is a complication that may happen during any surgery. There may be injury to the bowel, there may be injury to the blood vessels, to the bladder. So it's better to mention it at the beginning, because the patient will be sleeping or will be under anesthesia. So we cannot take a consent of any extra procedure during the surgery unless repairing of these damaged organs. Am I clear? Yes or no? So you have to mention each and every point in the station, go step by step. I can see here also means that you take the point of general or regional anesthesia, which is very good, because the patient will need one of them after discussion with the anesthetist. The next point, always positive. Now we mentioned the positive at the beginning, the negative points, or what has to be done better in between. Now close with positive. Very well done, Yasmin, that you put your signature and you will put your rule also, and the date, which is very important and medical importance. And also it's very important to ask the patient to put her sign here, and very good that you put a circle here around that the patient will be provided a copy of the consent. So don't you think, Yasmin, if we will add these points to the consent form, it will be more legible and more informative. Is that okay? So, Yasmin, I will give you some performance of the unit with the consent form about cesarean section. You can go through it. We will change this consent together to make it in the perfect way. And I will provide you with some articles regarding the principles of writing a consent and the cesarean section consent advice. So, Yasmin, what do you think? How it went? Now I'm asking my colleague about his feedback about the station. I give him my feedback about his consent. Now I'm asking him the last step about his feedback about the teaching decision. If he needs anything extra, if he needs anything to be done better in the next time to make the session more better. So thank you, Yasmin, for being involved in the job early. I'm here for help and support at any time. And thank you for your time and have a nice day. This is the way how to give a feedback station. Always remember in the feedback station and in the teaching station to start the station with a smile and to close the station with a smile. Because this is your colleague and you are going to give him some information, or in between you are telling him that he did some mistakes. So start with a smile and end with a smile. It should be in an unblaming atmosphere. Start with the positive. In between, give the mistakes and how to correct them, and end with a positive and provide him and support him in his going training or her ongoing training by giving some articles, some videos, or advise him regarding some training sessions or training courses. This is how to give a teaching station or to give a feedback station. So introduction, make a rapport, ask about the aim and the aim of the session, ask about any concerns or expectations, ask about the background of the station and put the agenda. The agenda will be from the agenda that was given in the scenario. Then come through the points of the agenda one by one. After finishing the points, ask him about his feedback about the session and support him in his ongoing training by giving articles and giving videos or training modules. Is that clear? Any
Yes,
questions?
doctor.
Yes, doctor.
Any questions?
No, doctor, you have explained really nicely. Thank you so much.
So,
Thank you, sir. Sir, I have one question. The boxes which they given, there are no tick marks there. So we have to talk about these things or no need? If because some they are tick and some they are not tick.
what again, please?
There is a boxes there. The one it is written, see the following leaflets has been provided. So there is a tick mark is not there. So we have to comment this one or no need?
And you have to comment about this also. You have to ask if she provided the patient with the patient information leaflet or no, because the patient has to know about the hair surgery and about the alternatives, including no treatment. Yes or no? You have to take yes or no about this one also. Yes, you are right.
It's not tick now. That's why I'm asking. We have
Yes,
to get
yes. You have to go through each and every point in the consent form. You have to ask if it is a simulated patient. You have even to ask the patient to sign the consent at the end. Okay, is that clear? Any other questions? So thank you, Dr. Yasmin. Thank you so much for helping us in the session today. Thank you for the volunteers who shared today. It was a good opportunity for me and for you to explore these two stations. I will announce on the group, and by the way, these are the contact.
Group link.
I'm sorry?
Sir, group link.
Yes, I will send the group link. The group name is MRCOG Part 3 Mission Possible, and I will send the group link. And these are the contact number, and this is the YouTube channel. I will send on the group today a strategy video about the same station that we did before, the good candidate and the, I will not say the bad candidate, and I will say the candidate who did it in a wrong way, so you can see how to do it in the proper way and how to do it in a wrong way. Okay? Any questions? Thank you so much. And on the group, I will announce, inshallah, about the next session, and the YouTube lecture will be for the next week. Thank you so much and have a nice day. Wassalamu alaikum wa rahmatullahi wa barakatuh.
Thank you,
Thank
sir.
you so much, dear. Assalamu alaikum.
Thank you so much.